Welcome, everyone. My name is Vinny DeMarco. I'm the president of the Maryland Healthcare for All Coalition, and we're thrilled to be here with you today to celebrate Maryland's landmark Easy Enrollment Health Insurance Program, which was enacted in 2019 and is now a model for the rest of the country. You're going to be hearing today a couple of things. You're going to be hearing how important this program is and how people can sign up now for healthcare. You're going to be hearing how other states have followed our lead, and you're going to be hearing how Senator Chris Van Hollen is taking this nationally. But let me just start by saying Maryland is 5th best in the nation in expanding healthcare coverage. The Easy Enrollment Program is part of this. Our goal is to be first. Our goal is to go from 6% uninsured to 0% uninsured. And one of the ways we're going to accomplish that is by fully enrolling everybody who's eligible now for free or low-cost health care and not enrolled and getting them enrolled. And one of the key methods is Easy Enrollment Program. So we're going to start today with one of my all-time heroes. I was so upset when Chris Van Hollen won his seat for Congress and left the Maryland State Senate. He was a great Senate leader who got a lot done here, expanding health care by increasing tobacco taxes and doing so much else no one else thought could be done. But of course, he's been a top leader in the U.S. House of Representatives and now in the U.S. Senate, including Senator Van Hollen. Thank you for all you did to get enacted the Inflation Reduction Act. Let's have a big hand. Nobody did more to make healthcare more affordable for people, make prescription drugs more affordable, and save our climate than Senator Chris Van Hollen through the Inflation Reduction Act. I could go on for hours saying how great he is. I won't, but I'll just let you know he is a #1 hero for all Americans in the Senate, and we're thrilled he's here with us. Senator Chris Van Hollen.
Thank you very much, Vinny. Well, thank you, Vinny DeMarco and Maryland Healthcare for All. Let me just say that in order to pass legislation at the state level or the federal level, you need to mobilize grassroots support. Members of the legislature, members of the Congress, members of the governor's office, comptroller's office, we listen to our constituents and we act. And Vinny DeMarco and Healthcare for All have really helped push Maryland to the forefront of affordable health care through working with their legislature and others. So it is great to be here today. Also, I want to say thank you to Reverend Connor for your great leadership on the board of Healthcare for All. Great to be here with the comptroller, our new comptroller Lierman. I was here from the swearing in, and good to be back today. Look forward to coming back often. And to our Lieutenant Governor, ARUNA Miller, who also just hit the ground running, was sworn in recently. Great to see you again as well. And to Brian Feldman, State Senator Feldman, who authored that 2019 legislation that really moved Maryland forward. And of course, to one of the people who implements it, Michelle Elberly. So it is great to see Team Maryland here today. And I wanted to be here because Maryland has been a beacon for the rest of the country when it comes to providing more access to affordable care. And I want to salute Senator Feldman and Delegate Pena-Melnick for authoring the legislation that came into law. And we're here in the comptroller's office, and I know she's going to talk more about it, because the comptroller plays a critical role in making sure that we connect more Marylanders to health insurance through their filing of tax returns. So in Maryland, we have 370,000 uninsured people, but half of them, 185,000 of them, are uninsured not because they are not eligible for insurance, but because they haven't been able to access the insurance that they're already eligible for, whether it's through Medicaid, whether it's through CHIPS, whether it's through the Affordable Care Act and the Maryland Exchange. 185,000 Marylanders already eligible, just not receiving the affordable care that they need. And that's why this initiative in Maryland was so important, because already 120,000 Marylanders have used the checkoff box on their Maryland tax returns. 10,000 of them have already been signed up, but we're heading toward tax season again, and we want to encourage all Marylanders who were eligible, just to check that box if you don't have health insurance, to find out what is actually available to you. This program's been so successful, I think it's been adopted in 9 other states. And it's so effective that I've decided to introduce legislation on Monday in the United States Senate called the Easy Enrollment Act in Healthcare. Easy Enrollment in Healthcare Act. To make this a federal program, so just like you currently check the box on your Maryland tax form, all people who file income tax forms in the United States will be able to check a box on their federal income tax return. That information then will be directed to the Maryland exchange in the case of Maryland, or the other exchange or in other states. And so that individual will find out right away what options he or she has for signing up. And there's a 60-day special enrollment window built into this legislation that will encourage more and more Americans to sign up. I gave you the figures about how many Marylanders are eligible for health insurance but not obtaining it right now. Nationally, the figure of the number of Americans who are eligible for health insurance but not signed up for it is 7.3 million people. 7.3 million Americans who are, we estimate, already eligible for one of these programs, but because they don't know about it, or because it's been not so convenient to set it up, or they haven't navigated the internet, they're not signed up. That's a lot of people. I should also mention that if we are able to do this at the federal level, Maryland will also benefit. Even though they already have this program, they'll get additional information from those federal tax returns that are not on the state tax returns that will enable them to reach more Marylanders at the same time. So this is one measure we're taking among many. I just want to flag 2 things. As Vinny said, we did pass the Inflation Reduction Act. That was a very, very big deal for Marylanders because it has made health insurance more affordable for 153,000 Marylanders, meaning they pay lower premiums. And that's a couple $100 savings on average. And there are 38,000 Marylanders that will now be eligible under the Affordable Care Act to sign up who were not previously eligible for insurance. That's because we expanded the number of Americans and Marylanders who are eligible for federal premium support for the Affordable Care Act. On top of that, there were the savings, and President Biden talked about it, that all Marylanders on Medicare will receive in terms of the prescription drug costs. So those are 2 things that are happening, as we speak. And on Monday, we're going to be introducing in the Congress this important legislation to follow the Maryland lead, the Maryland model, and take it national. And I want to thank everybody who's been made that possible here in the state, so we can follow your good example for the United States of America. Thank you all for being part of it.
Thank you, Senator. We love Chris Van Hollen. Thank you for being a national leader. In 2019, as the Senator said, Senator Brian Feldman, Delegate Jocelyn Pena-Melnick got in the 2019 Easy Enrollment Law. One of its strongest advocates was then Delegate Brooke Lierman. She fought hard for it and helped get it done. So we thank you so much for doing that. And we were all thrilled when she got elected comptroller, because we knew then that there would be an advocate for people of Maryland in the comptroller's office who would fight very hard and very well to implement laws like this. A law like this takes a lot of smart implementation. And the comptroller's office can make it happen the way it is now, and hopefully soon with the automatic enrollment for people eligible for Medicaid. But no one we know could do that better than Brooke Lierman. She was a terrific legislator and is going to be one of the best comptrollers this country's ever had. Brooke Lierman.
Thank you. Thanks, Vinny. Thank you. Good morning, everybody. It's really my pleasure and an honor to welcome you to the Treasury Building. Thank you so much for allowing us to host today. Vinny, it's great to see you. Thank you to our Lieutenant Governor. You're always welcome down the block here from the State House. Senator, even a half a block away, you're welcome. And thank you for making the trip. And thank you both for all of your work on this. So a huge thank you to everybody for being here today. You know, as someone who has been without health insurance in my past because of a pre-existing condition, I know firsthand just how essential having high quality, affordable health insurance is. And that's what this is about. Making sure that every Marylander has access to high quality, affordable health insurance is a true team effort. It means we have to work at the federal level. We have to work with our state legislators, with our governor, our lieutenant governor, our advocates, the comptroller, and we have to make sure that it is implemented faithfully and fully through our health insurance exchange and through the comptroller's office. And that's why it was so important for me to be here today to make sure that Marylanders know that all they have to do on their tax return, and in fact, we are in tax season right now, through April 18th, from now till then, when you file your tax returns, if you have a question, if you're not sure, but you think you might be eligible for health insurance, just check that box and we will get in touch with you. The Health Insurance Exchange will be in touch to make sure that you know your options for signing yourself up and even your family members to make sure that every Marylander has access to that insurance and to life-saving prescriptions, to important medical care. You know, as a mom with 2 kids, I know that those trips to the doctors can be expensive without health insurance. So it's just essential that people sign up today. You know, Maryland's success, I'm so proud to see as somebody who voted for and advocated for that 2019 bill, our success has inspired other states to establish their own easy enrollment programs, including Colorado, Virginia, Pennsylvania, Massachusetts, New York, California, Illinois. And of course, there's more to do. As Senator Van Hollen said, I am so excited that Maryland has been this, you know, laboratory of democracy, inspiring the senator and others to take this national, because we know that not only Marylanders should benefit from this easy enrollment program, but really all Americans should. So I hope that taxpayers, our Marylanders out there know, just check off that box. I'm excited to be here as the 34th comptroller, and also want to ensure people that we are not going to give up until it's easier and easier and easier to enroll. Now, we have some old systems here in the comptroller's office. We're going to be working, one of our biggest efforts is to modernize our tax service and our tax returns infrastructure. And when we do that, we'll make it even easier for people to access these important programs and more. So thanks to all of you for being here. Thank you, Vinny, for your leadership. And I look forward to being a partner to the Maryland Health Insurance Exchange and all of our elected officials to ensuring that every Marylander has access to high quality, affordable health insurance. Thanks.
Thank you so much, Madam Comptroller. We're honored to be in your house. Thanks for hosting. We look forward to being your partner. I was so privileged and honored to be at the inauguration of Wes Moore for governor and ARUNA Miller for lieutenant governor. And that was a beautiful ceremony. And you spoke so brilliantly, Lieutenant Governor Miller, about health care and the needs for health care. Of course, you were outstaged by your daughters, but it's all right. You were great. And Governor Moore made clear that one of his priorities in leaving no one behind is to make sure all the hundreds of thousands of people who are still uninsured get insured. He said that right off the top. So we were honored to be working with the Moore-Miller administration. And I just want to say that ARUNA Miller was one of the most impactful and forceful and hardworking public health advocates when she was a delegate. We loved working with her, and the successes we made while she was there were amazing. And now we're so looking forward to working with her as Lieutenant Governor, and we're thrilled you could be with us. Lieutenant Governor?
Thank you, Vinny. Well, good morning, everyone.
Good morning.
So I just wanted to say on behalf of Governor Wes Moore and the Moore-Miller administration, thank you, Senator Van Hollen, for taking the easy enrollment program to the federal level. There's not a lot of things easy at the federal level, so I really appreciate your efforts here. Thank you for your leadership. Also, Comptroller Lierman, thank you for opening your house here, office to all of us. And to Chairman, my senator from District 15, Chairman Brian FELDMAN, as well as, I don't think she's here today, but Chairman and Jocelyn Pena-Melnick, who are the authors of this great program. So thank you for your leadership. And Vinnie DeMarco, of course, everybody knows you, and we're so grateful for your enthusiastic advocacy for healthcare. Really, really appreciate it. Michelle Eberle, thank you for taking care of the Maryland Health Exchange, Benefit Exchange. And Reverend Sandra Connor, thank you for your leadership as well. And to the many advocates who work hard each and every day to make life a little bit easier for Marylanders and the uninsured. The process of healthcare insurance enrollment is complex and difficult, even under the best of times. And of course, challenges have been compounded after the pandemic. Sorry about that. But there are practical steps that we can take that would allow Marylanders who need help and are qualified to obtain free or low-cost health insurance. It begins with maximizing touch points and meeting people where they are. The Easy Enrollment Health Insurance Programs allows Marylanders to begin signing up for affordable health insurance directly through their tax returns by simply checking a box and affirming that they would like to receive more information about healthcare on free and low-cost health coverage. And since 2019, as you heard from many of the speakers already, more than 100,000 Marylanders have checked the box and more than 10,000 have signed up for affordable health insurance. Maryland became the first state, as you heard as well, in the nation to establish a tax-based easy enrollment program. Numerous other states have followed in suit and established the easy enrollment program. A government of the people, by the people, for the people is about removing barriers for our citizens and providing easier access to a fundamental right such as health care. Governor Westmore and I are grateful for all who have dedicated their lives for making life a little bit better for Marylanders. So thank you.
That was beautiful. Thank you very much. Thank you, Madam Lieutenant Governor. We look so forward to working with the Moore-Miller administration. And as you've heard, in 2019, Senator Brian Feldman, Delegate Jocelyn Pena-Melnick got this first in the nation law. By the way, that same incredible year, they got enacted the first in the nation Prescription Drug Affordability Board law. And they are real national leaders. I talk about Brian Feldman all across the country as one of the best legislators, one of the people who gets things done. And he's even helped us in other states to get his colleagues to vote for these kind of laws, both easy enrollment and prescription drug affordability. So let me just say we are thrilled that Senator Feldman, now Chairman Feldman, I'm sorry, Chairman Feldman, we're thrilled. He's a chair of one of the standing committees and a real fighter for public health. And he is right here today to tell us more about the easy enrollment law from his perspective. Senator?
Well, I do want to give a shout out to Chair Pena-Melnick. So back in 2017, when we thought that there was a repeal replace movement in the United States Congress, we created a commission called the Health Insurance Coverage Protection Commission to, if in fact the ACA was repealed, what would we do here in Maryland? It was that commission that was the genesis for a lot of these really great innovative ideas. As was mentioned, the Prescription Drug Affordability Board, which was, I think, something else Senator Van Hollen's looking to do at the federal level, first in the nation. We're now up to 6 or 7 states, and it's true. Vinnie had me lobby my friends in the Senate Finance Committee in Virginia last week, and the Senate Finance Committee in Richmond passed a Prescription Drug Affordability Board. There are 6 states that have done that. We were, other innovations, I just got it going from 12, 13% uninsured to 6. We want to go further, was an young adult subsidy program, a 2-year pilot project where for lower income young adults between 18 and 34 who think that they're going to live forever, they're the ones that drop their health insurance. We rolled that out 2 years ago. 47,000 folks, young adults in that category, have signed up for health insurance. In fact, we have a bill this session to extend that, make that more permanent. In fact, the Prescription Drug Affordability Board is sunsetting. We had a bill this week that I introduced to extend that board. And then finally, it's nice that we're here talking about how great this is. It wasn't such an easy path in 2019. The bill that came in was a Romney Care individual mandate bill that the governor was, at that time, Governor Hogan, strongly opposed to. It was very polarizing. We went through all kinds of iterations and ultimately end up with, I think, an amazingly simple, easy to administer with the collaboration of a comptroller that was interested in doing this. We came up with this program, which I think makes so much sense. And so I'm thrilled that Senator Van Hollen's taking this innovative product to the federal level. I hope he does it with Prescription Drug Affordability Board and some other things. And we just have a great team. I will say that the final point I want to make is, there was some pushback on this about administratively, was it feasible to put it on a tax return? And Brooke Lierman talked about the reforms of modernizing this office, which is going to make all these kinds of things so much easier. So I'll stop there. I love being with my #1 constituent, ARUNA Miller, with Senator Van Hollen. And one final thing, Michelle Eberly, one of the other things we did this past 4-year term, created the largest reinsurance program in the nation, which has resulted in our health benefit exchange having the lowest premiums in the United States of America if you get your health insurance on her exchange. So we have a lot to be proud of. I'm going to stop talking, and with that, I'm going to yield back to you.
Thank you, Senator. We love Senator Feldman. Great leadership. I want to recognize a couple people in the audience. One of Maryland and America's top civil rights leaders, Carl Snowden. Where's Carl? Carl, thanks for being here. Our terrific lobbying team, Len Lucci and Stephanie Anderson, they're there. Welcome. Stephanie, Suzanne Schlottman and Catherine Kirk-Robbins, Deputy Directors, Healthcare for All. And my son, Jamie DeMarco, works at Chesapeake Climate Action Network, wearing the same suit I am. So thanks. Now I want to turn to the person who implements this along with the comptroller. We have the very best health benefit exchange in the nation. Under Democratic and Republican governors, our exchange has done such a great job. Not every state has cut their uninsured rate in half since the Affordable Care Act. We have. Thank you, President Obama. Thank you, President Biden, for all you're doing. But it couldn't work without a terrific exchange led by just a wonderful person, Michelle Eberly, who's a terrific leader, and I'm thrilled she's here with us. Talk to us more about easy enrollment. Michelle.
Well, thank you very much. And first, I want to speak to you as a Maryland resident, because I'm not so sure everyone knows how fortunate we are to live in the state of Maryland, where for years there has been a strong support for health care for Marylanders. So you heard a lot what Senator Van Hollen has done, what Chair Feldman has done, and Chair Pena-Melnick. That has been ongoing for years. And I remember I've been here since the beginning, the first year of the exchange, and sitting in rooms and talking about the easy enrollment program and talking about how we're going to get health care to all. And never once have I had resistance from our legislature, from the administration, whether it was Democrat or Republican. And I will say I am thrilled to pieces under our new Moore-Miller administration and under Comptroller Lierman to really continue to move that ball forward. But I always like to remind everyone that Maryland is unique and not every state has what we have. So we have to start this discussion by really appreciating all the powers that move Maryland forward all the time. And then second, I get the pleasure every day of overseeing the Maryland Health Benefit Exchange. And we have just a wonderful team that is committed to our mission, making sure everyone in this state has affordable health coverage. We have really increased that over all the years. Every year we keep increasing our enrollments. About 1 in 5 Marylanders come through Maryland Health Connection now, whether they're getting free coverage through Medicaid, whether they're getting affordable coverage through the Affordable Care Act, whether they're buying a standalone dental plan, or they're a small business getting health coverage. So 1 in 5 Marylanders are getting health coverage through us. Yet we know that not everybody is aware, and we're always scratching our head because we spend a lot of money on outreach activities, marketing campaigns, and we still find people have no idea what they have eligible. So when we go out in the community, we talk to folks, we realize people are just living their days. They're surviving. They're going from, getting kids to school, getting meals on the table, making sure they can get their rent paid, all the normal things of life. And many feel that they can't afford health coverage. If they're not getting it through an employer, they can't afford it. The check the box on the tax returns about 3/4 of the people that come through that, check the box, are eligible for no-cost health insurance. They had no idea that that was available to them. So that's the power of all these access points, of checking the box, getting people to know that all they have to do is check that box. Then we'll reach out to them. We'll make it easy for them. So I just want to end by, again, being so grateful to everyone on this stage who has made my job easy to really bring health coverage to all Marylanders. And Vinny, thank you for being our forever #1 cheerleader.
Thank you, Michelle. Thank you very much. None of our progress in healthcare in Maryland on easy enrollment, prescription drug affordability board, any of the work we've done would have been possible without the faith community and their incredible advocacy and leadership. So we're going to end with words from Reverend Sandra Connor, who I'm proud to say is the first woman ever made head of the Baptist Ministers' Nice Conference of Baltimore and vicinity. Reverend Connor.
Good afternoon, everyone. First of all, I'm going to follow Michelle's suit. She said first. I'm going to tell you first as to why I'm wearing this red jacket and why I've been little out of place a little bit, just a little bit. But I want to let you know that this week is, this whole month is Heart Month. And we in the faith community are asking constituents, our faith community folk, and even you to wear something to be symbolic of the health. We want you to know that your health is important. Your health is important, your heart is important, and it doesn't matter if you're female, male, whatever. We want you to pay attention to your heart. And this is Heart Month, and so therefore we want you to be mindful of that. And so I'm modeling what I believe in and what I do, and that's why I'm standing here now. I'm also here representing the faith community. When I model things and do things, when I speak out about stuff, I want to make sure that we all understand. Outreach is very, very important. If you are a faith leader, if you are anyone that's in this room, if you listen to this press conference in any kind of way, I encourage you to take the information that you get it. Don't just simply let it go in one ear and go out the other, and you do absolutely nothing. We heard that the numbers are up, like 7 million in the whole United States. So that means you've got family members somewhere else that's beyond Maryland who may not have health coverage. And so I'm encouraging you all to take this information today that you're getting. We know that easy enrollment is an easy way for people to check the box. I may not go anyplace else. I may not even think to call the Maryland Health Exchange, but if I can just simply check a box, it's an easy way for me to perhaps get connected to health care. It's an easy way to have perhaps access to health insurance that might tell me whether or not my heart is right or any other health situation I may have. I'm encouraging you all to please take this information. You become the advocates. You be the ones to go forth and tell somebody, share with your family members to let them know that they have until April the 18th to check the box. Check the box is so easy to do so, but make sure they know that they can get perhaps cheaper insurance than what they've had before. If they're eligible, check the box. Thank you.
Thank you, Reverend Connor. We're going to open up the questions. Before we do, don't anybody leave until we get a picture behind our banner, okay? Don't leave. So first of all, I want to just reiterate the main points here. As Reverend Connor said so eloquently, check the box. If you're uninsured, check the box. At tax time, we'll get you insured. Secondly, Comptroller Lierman's going to make sure this law is fully implemented with the exchange, with Michelle and the exchange, and we're going to work closely with Senator Feldman, the Moore-Miller administration to get this done in Maryland even better. And Senator Van Hollen, thank you for taking this national. So that's our messages today. Any questions before we close up? Yes, Danielle.
Can somebody, it might be Michelle, explain more fully what happens when somebody checks the box? So you get a response. Is it individualized? Does that response only go to people who might be eligible for a free or low-cost program, or does it go to everybody who checks it? Like, what exactly happens?
So this is a wonderful collaboration with the Comptroller's office, because the Comptroller's office obviously has all the data. When they check the box, they send a file that's giving authorization to send data to the exchange. We take that data, we run it through our eligibility system, we send a letter out saying, hey, here's what you are eligible for. You could get this coverage, you could get that coverage, this would be the cost, this would be tax credits, and we send that letter out to that consumer. Then we also can follow up with sending a follow-up if they provide their email, an email or a text. If they come into the system and start the process but don't end it, we follow back up and say, hey, we see you started the process. So it's really hands-on. And then we also have our navigators make phone calls to these folks to say, we see you're eligible for coverage. How can we help you?
Thank you, Michelle. That was great. I just want to emphasize the law as written by Senator Feldman and Delegate Peña-Melnyk also includes in it that the state can use auto-enrollment to go beyond what Michelle said and automatically enroll anybody who checks the box and is eligible for Medicaid if they want to be enrolled. That has not been implemented yet. We look forward to working with Comptroller Lierman and Michelle Eberly to get that done. Thank you for that question. Yes?
And how do you plan to get this message out to non-English speaking Marylanders?
Do you want to take that, Michelle? Non-English speaking Marylanders?
Oh, we have, so we produce our notices in multiple languages. So if we know what language they prefer, we have that. If they call our call center, we have access to over 200 languages so that we really can support anyone.
And, I would just add that there are, the Cash Campaign of Maryland, VITA Services, community action agencies around the state, as well as the Comptroller's Office. We do outreach, of course, in multiple languages to make sure that people know how to file their tax returns and to make sure that, they see then that box is on the form as well.
Great. Two great questions. Any other questions? Thanks, Vinny. Okay. The dean has called us over. Thank you.